Welcome to another Community Foundation of Middlesex County pop-up grant video. This one is courtesy of our friends at Whelen Engineering, and this time we're talking with a nonprofit nominated from their New Hampshire campus. We're really excited to have you here, Samantha Ball of Valley Health Connections in Vermont. Yes, and everybody in our area in Connecticut's always like Vermont. And so we can talk about that, which is the Whelan, New Hampshire campus is very close to the Vermont, New Hampshire line. And so we're meeting wonderful nonprofits from that whole region. So we're so thrilled that you were nominated. And a big shout out to High French, your nominator at the Whelan campus there. And welcome, Samantha. It's so nice to have you here.
Thank you. I'm so happy to be here.
So we love doing these because we have met incredible nonprofits. We've been very much looking forward to learning more about what you do in your region, and we're so excited to be able to share not only a wonderful partnership with Whelen Engineering, but a wide array of nonprofits that are doing really great things within the community. So why don't you? I'm sure there are plenty of people watching who may not know what Valley Health Connections is and what you do. So what's a little bit of background about your organization?
Yeah, so Valley Health Connections, so we're a nonprofit that primarily focuses on health insurance and removing barriers for people to access the care that they need. So we are one of 8 clinics tied to Vermont's free and referral clinics. We have 5 freestanding traditional free clinics. And then there are clinics like Valley Health Connections where we are referral clinics. So someone walks through our doors oftentimes to talk to us about health insurance and the barriers that they are finding to getting health insurance, understanding health insurance. How do we navigate the Affordable Care Act? We have Vermont Health Connect in Vermont, and it's confusing. You,
Mhm.
no one's taught this in school. So our job is to take people in. We educate them. We start with, do you know what a deductible is? Do you know what a copay is? No shame. You were never taught. And we empower people to start taking charge of their health care. We help connect people to primary care doctors. A huge piece of what we do is we also help navigate Medicare, which is a whole separate world that is so confusing coming off of regular health insurance. So traditional, when people think health insurance, you've got that kind of picture of it's my deductible, it's my copay. Medicare, whole different ball game. So we help navigate that piece. Um, we also do a lot with Medicaid and helping people sign up for that program as well. We have grant funds to help with dental care and medication purchases, which is a massive hole kind of, that people, their teeth and medications are some of the first things to go by the wayside when people can't afford general everyday expenses. So we help connect to a dentist. We help fund care um, for medically necessary treatment. And if we can't fund it, we help to try and piecemeal and apply for other grants and really get people what they need. Um, we also, medications are, that's one of our biggest, that is huge.
Yeah.
Medication affordability is so incredibly tough. And last year, between the 4 of us, we accessed and secured over $500,000 worth of free medications for, yeah, and
Oh
that's
my
Vermont and New
gosh.
Hampshire. Yeah,
Wow, that's
it
incredible.
was
Good for
huge.
you. That
Yeah,
really is. That is
yeah,
truly remarkable. That's wonderful to hear. And thank you
yeah.
so much for doing that. That is like that. I know have known so many people that that has been a real struggle, and you hear about it every day, particularly with the cost of some medications, and yet they're very essential. And to find
Absolutely.
that much funding for that is truly outstanding.
Yes.
Samantha, I'm curious. You just said 4 people?
I caught that too.
So, yeah, what you're doing, to your point, is incredibly complex and difficult to navigate. So you have four people that work on, do you have a team of volunteers as well? Like, how do you, that's a lot
No,
of hats.
that's a lot of hats. So I jump in. I'm one of the four. I do a lot. So kind of during open enrollment period, which Medicare starts October 15th.
Okay, big
We
shout
are,
out there, everybody. Remember October 15th, right?
um, that is when I start kind of taking off my director hat, turns to the side, and I become the insurance person, where I am out giving talks about health insurance, bringing people in, and then the three staff members that we have here, they are filling schedules too, where we are mad racing
Mhm.
through Medicare, and then the ACA, Vermont Health Connect, starts November 1st. So up until January 15th, we are kind of, our entire world is health insurance
Mhm.
and having people evaluate what they need, look at what suits them best, and try and figure out when something doesn't work. If things don't fit a budget, what can we do? How can we, what's the long-term plan we can create? It's, I mean, when someone can't afford the medicine that they need, they end up in the emergency room because they couldn't maybe take care of their COPD because they couldn't afford their inhaler. That does not need to happen. So
Right.
we try and bring people in and figure out what to do.
So, do you find that most of the people who are coming to you or even calling for to see if you can help them or to get information, is it predominantly because maybe they went to a free clinic in the or a low cost clinic and they're referring them? Are you seeing more referrals from emergency rooms, or is it really just people Googling help me that who just have no idea and maybe you don't know, but do you get a sense of how most people are sort of coming to you?
Yeah, we try and ask pretty much everybody who comes through our doors, how did you find us? Where, because we have a website for the first time ever. So I'm always like, did Google send you our way?
And
But
we've been
we,
on your website, and if you people haven't, they should. valleyhealthvt.org. It's really informative. We've spent quite a bit, obviously, and ready to talk to you. But we encourage everybody. It's very well done.
oh, thank you. Thank you. That was the first task I took on when I stepped into the role. I was like, we need a website.
Right.
So we get a lot of our referrals from North Star, which so the Charlestown North Star office is right next to the Whelen campus. Um, so we get a ton of referrals from North Star, which is our local primary care office. Springfield Hospital is right up the road from us. We get a lot from their emergency room. Their case managers are excellent. They always are shouting us out. Our local community partners, or our local mental health agencies, um, substance treatment agencies, they are all referring to us. We we are being found, I think, through Google. Vermont Health Connect sends people to us. Word of mouth,
Right.
people that we've helped who have gone on to, I've been doing this next month. It'll be 11 years. Not that I've been a director, but that I've been in the insurance world and trying to help people understand insurance. Um, I'm getting people from my first year of doing this, remembering and then connecting them to either
Wow.
my office or someone in our our network, part of the Free Clinic Association. It's so cool.
That is awesome. And congratulations a month early on your anniversary. That's terrific. But I think that really speaks, that says volumes about how well people feel accepted and taken care of, and helped by you and your team. If you have that a long-lasting verbal ambassador network going on in your communities. I mean, I really think that does. So congratulations on that. And thank you so much for doing all of that, because that really does mean that people know and see you as a resource. And that's the most important thing right now.
Yeah, I feel like when someone needs help, the last thing that you want to do is inflict any sort of shame in that, where there's a lot of shame that comes in when someone is walking in because they can't afford a hospital bill. They don't understand health insurance and they feel like they should. No one is taught this.
Yeah.
There is no course in school that says this is how you access health insurance. This is what this means. This is what you do when you can't afford a medicine. So when people walk in, I always tell the staff, I'm like, the last thing they should do is leave feeling like more barriers have been put up, or that they've walked in and talked to people who, again, don't understand. So we try and do that as much as we possibly can.
Wow.
About how many people do you service in a month or a year?
Yeah, so typically in a month, we see our roundabout numbers. We're usually around 315 people a month.
Gosh,
Oh
four
my
people.
gosh.
Four people.
That's incredible.
Yeah. Yeah, it's a lot. So we do a lot over the phone. We have a lot of people who come in, but we're rural. We are like, transportation is difficult. So we do a lot via Zoom. We do a lot over the phone. It's a lot of follow-up. The amount of times that we are on the phone trying to follow up about insurance or answering questions, it's a lot. It's a lot of that. Last year was our biggest year. We saw just over 1,800 people for the year. So I think it was like 1,829. So,
Wow.
and I'm hoping, I would like to see us hit 2,000 this year. So,
Wow, that's incredible. That's truly incredible. Okay, so that lends itself to the question, because we know all of our nonprofits do great work, and obviously financial support contributions mean the world to all of our organizations. So that's a given. What would be the next thing that you would say your organization could use from the community? Do you use volunteers? Do you have other opportunities where people can help you do your mission?
yeah. So that is actually, I just went through, or I'm in the process of strategic planning with my board and the staff here. And one of the things we've focused on is we've never used volunteers. We were a traditional free clinic in the 90s. And then when primary care, when that accessed the community or came into the community more, we shifted and became a referral clinic. So we haven't used volunteers since, let's say, early 2000s. And that is something, the things that we cannot get done purely because we are sitting at a desk helping to manage the phone or work with the patients in front of us, that filing piles up, or faxing, like some of those general things, or even people to hand out flyers about us, or be like a little community billboard. That's what I always, that's something we are looking at, because spreading the word and being a voice for us when we can't be, that is greatly needed.
Okay,
Yeah.
there we go. There's your call to action for, like we said, we know, particularly now with all the needs that are going on in so many different areas, that everyone who embraces their local and thinks locally to support their local communities and the organizations working is great. But it also is, as you said, there's so much that goes on inside an organization, that you don't have to be the expert in the subject matter, because there's all this other stuff that is so helpful, and it's just it's making that connection and following up and reaching out. So there we go. Lots of opportunities to come and help Valley Health Connections.
Absolutely.
So what else? Because obviously we've asked you some questions, and you've given some background, but is there something very specific that you would like to remind the community, or help the community understand, either about your work or about in general, how they can connect in, or what they need to know? This is your opportunity.
Yes. Yeah. So we are primarily based in Vermont. So I would, especially because Whelan is located in New Hampshire, we absolutely help New Hampshire.
Okay.
We cannot with the Affordable Care Act on that end, but we can with Medicare. We can help with medication affordability. We can help with dental care. We can help get people connected to a primary care doctor. We are also, I feel like the general, I don't know what to do. I don't know who to turn to for help. I'm going to call Valley Health Connections. And if we can't help, we typically know someone who can, and we can at least give a number that should connect to the right service or walk through a problem. Is something that we talk about a lot is we don't handle nursing home care, but we know people who do. And there are a lot of caregivers in the world. And the burnout and trying to figure out what the next steps in life are, maybe for an aging parent, that's something we help get people connected to resources with and talk through. And I will plug, because we are about that time of the year, if you are on Medicare, there are huge changes this year.
Okay.
So starting October 15th, probably already being bombarded with mail. Reach out to a local nonprofit, your local area agency on aging, or if you're in the area, Valley Health Connections can help. Make sure you're looking because there's so many changes specifically for Vermont this year. And then again, if you are on the Affordable Care Act, November 1st through January 15th. Make sure you're looking at your plans.
All right, great pieces of advice there, and it's wonderful to know that you are a resource for the whole region, because and that leads us, of course, once again to a big shout out to Whelen Engineering and their partnership with the Community Foundation of Middlesex County on these surprise pop-up grants. So we're really thrilled to be able to surprise you with a small grant to say how much someone cares about you, and obviously to High on French. So I'm going to give you also an opportunity if you have any messages for Whelen, Samantha, or if you want to say something to High on for nominating you, please go right ahead.
Yeah. So a huge thank you to Whelen and everything that you do for the community, and Hyon specifically for nominating us. Absolutely. It's so nice these days to get a nice surprise. This was I got the email notification on a Monday, and it was such a nice way after hearing so many challenges facing people to get what they need. It was such a nice way to start my week and get a happy surprise.
Oh, that's wonderful. We're glad that we could start your week off with a smile. And we are honored that and not surprised. So I really do want to stress, Whelen Engineering is so committed to the communities where they have campuses and where their employees live, and the broad community and everything that happens. And we're honored to help them find ways to raise awareness, put some great spotlights on incredible organizations that are serving the community and those that their employees really are connected to and appreciate. So this is such a fun adventure for us, and it's been a great opportunity to get to know you. And thank you so much for sharing so much about your work.
Thank you.
Great. All right. Have a wonderful day.
You too.